Hello everyone, my name is Alexa Peña Aldaco, and today I will compare and contrast the needs identified in my research on the immigrant population in the United States with the needs that emerge from my survey data collection. I will also discuss key lessons learned and barriers encountered while implementing my advocacy efforts. From the research literature, immigrant needs are largely described at a systemic and structural level. Commonly identified needs include limited access to affordable and culturally competent healthcare, language barriers, legal and immigration related stress, and inequities related to social determinants of health, such as housing, employment, and education. Research emphasizes how policies, insurance restrictions, discrimination, and immigration enforcement contribute to long term disparities in health and well being. These findings provide a broad picture of how institutional systems shape immigrant experiences across the country. From the data that I have collected, 100% of the participants have been living in the United States for more than 10 years. Additionally, all of them migrated to the United States for opportunity. The biggest challenge that they faced was language barrier, followed by employment opportunities, cultural adjustment, and legal access to legal documentation. 50% of them said that they have had a somewhat positive experience living in the United States, and 50% of them stated that they communicate daily with family or friends in their country of origin. 100% of the participants feel integrated into their local community in the United States, and 50% of them stated that their biggest support that they have received while migrating to the United States was being given the opportunity to work. While research discusses these issues in general terms, the survey data highlighted how these barriers affect daily decision making, such as delaying care or avoiding services altogether. In contrast to research, participants spoke less about policy in abstract terms and more about how policies create fear, confusion, and instability in their everyday lives. Overall, the research and survey data were aligned, but they differed in focus. Research helped explain the why behind disparities, while the survey data illustrated the how immigrants actually experience and cope with these challenges. Several lessons were learned through implementing the advocacy effort. First, community trust is essential. Participants were more willing to engage when outreach was culturally sensitive and communicated clearly that participation was safe and 100% confidential. Second, combining research with firsthand data strengthened the advocacy message by balancing evidence with real life experiences. Finally, flexibility was critical, adapting survey methods and timelines helped increase participation and data quality. However, there were notable barriers throughout the process. During the planning and campaign development, limited access to immigrant communities made outreach a little bit challenging. And then there was also fear related to immigration enforcement, which also reduced participation even when anonymity was emphasized. Language barriers also affected survey completion and required additional time and resources for translation and clarification. But despite these barriers, the advocacy effort reinforced the importance of community informed approaches. Integrating research with survey data provided a more comprehensive understanding of immigrant needs and highlighted the value of listening directly to the populations most affected when advocating for meaningful change.